Good morning, everyone. My name is Devin Fishburne, Marketing Manager at MDIC, and I'm here to wish you a very warm welcome to another edition of MDIC Live, a fireside chat style series highlighting the latest projects, resources, and happenings within the Medical Device Innovation Consortium. On today's episode, MDIC's Digital Health and Technology team will recap their most recent cybersecurity summit and talk about the future of cybersecurity, threat modeling, and penetration testing. Please join me in welcoming back Senior Program Director Jithesh Veetil and Project Manager Noor Falah. Good morning, guys. Thank you for joining us.
Good morning. Thank you for having us, Devin.
Thank you. For the folks that are watching at home via LinkedIn, Twitter, YouTube, and Instagram, before we get started, I wanted to remind you that this session is going to be interactive. So feel free to post your questions for the team here in the chat, and feel free to keep the conversation going with others in the chat as you watch. We love to watch collaboration, so feel free to bring all your ideas to the chat here today. Without further ado, for Jitesh and Noor, let's get to our questions.
Sure.
So first, Jitesh, we've met you before here on the show, but for Noor, who's new, tell us a little bit about yourself and your experience as well as your role here at MDIC.
Sure. So, hi, everyone. My name is Noor Falah, and I'm the Cybersecurity Project Manager at MDIC. The reason why I'm here today is because during my time in grad school, I participated in a research project that focused on utilizing AI to monitor patients with heart failure. I had learned a little bit about medtech while I was completing my undergrad and my grad school degrees, but I wasn't very familiar with the industry and how large and how much it spanned. So after a little bit of research and completing my own research project, I found MDIC and I really love their mission statement and all the work the organization has been doing. So here I am today.
Cool. And Jitesh, for anyone that didn't get to meet you the first time around, do you want to tell us a little bit about yourself as well?
Of course. Again, Devin, thank you for coordinating this session. I've been with MDIC for almost 4 years now. I lead the programs under digital health and technology portfolio, which includes, of course, cybersecurity. And those who have joined in previous session, we talked about computation modeling and simulation. And we do have a lot of other programs revolving around the software, AI, ML areas for medtech and so on. My background, I've finished my PhD in biomedical engineering from University of Arkansas. Did a lot of research at the National Institute of Health, and then worked at the NIH campus for a couple of years before moving into the nonprofit world. I have served as a program director for another preclinical research organization before moving to MDIC in this current role. Really excited to be here today and looking forward to this interactive session focusing on cybersecurity.
Thank you. And we're looking forward to diving into the topic. So, without further ado, Nora, as you mentioned, cybersecurity is so wide ranging. It's one of the more interconnected topics of today's world. And I think for the folks at home, they might be wondering, how does that connect to the medical device industry? And why was this initiative for cybersecurity started at MDIC in the first place?
Okay.
Sure. So, just like you said, Devin, there are many devices within the medical field, from pacemakers to insulin pumps to MRI machines or even glucose monitors. These are all examples of devices used every day by the medical community, and they all house opportunities for cyber attacks. It is unfortunate to say, but we live in a day and age where cyber attacks are becoming more common, and they are included among the medical field. So hospital systems have fallen victim to ransomware, for example, and it does affect their day-to-day operations, and it affects ultimately the well-being of patients. And working in the medical field, that is our mission, to protect the patients and their well-being. So these are all examples of how cybersecurity impacts the medical device industry and why our work here at MDIC is so important.
Yeah.
Jitesh, question to you. Why was the initiative for cybersecurity started at MDIC, and sort of what are the goals for that initiative?
Yeah, I think Noor actually captured it really well. As you can imagine, with all this advancement in the technology, a lot more devices in the healthcare spectrum are connected to internet, and not only internet, it can be connected to Bluetooth or other, I mean, by other mechanisms, and that potentially opens up vulnerabilities. And as Noor mentioned, that we have heard cases about a lot of ransomware and other things. Now, I just wanted to make sure that the impact is multifold. In some cases, these attacks are cyber attacks are just to collect personal information or patient information. But on the other extreme, it can be quite dangerous. It can be a life and death situation. For example, let's assume it's a cardiac pacemaker, right? And if somebody is able to manipulate remotely, and that's going to be a life and death situation. And it has been demonstrated that has been possible. So, as you can imagine, with more and more devices, this of the hackers and ransomware attacks are going to be on the increase, right? So we should be taking a very concerted approach, very collaborative approach, because nobody has got a perfect solution here. Because considering the diversity of the devices and the spectrum here we are talking about, there's a lot to do. And again, there is no 100% or perfect secure device. It's going to be an evolving collaborative effort, and I'm so happy, excited to be involved through MDIC platform to contribute to this cause, the broader cause of securing the devices. So from MDIC's platform, I think past 4 or 5 years, we have been working on the cybersecurity side for medical devices. We started with a communication piece or a white paper on vulnerability disclosure, which is, again, as you can imagine, we need to communicate about our potential vulnerabilities and should have a mechanism. Again, we can't just keep hiding about the vulnerabilities. We should have a proper mechanism when the vulnerabilities are identified. So we worked on some of the case studies and some mechanisms which can be utilized by med industry. And then we started building up on that and worked on multiple projects. And as Devan, you mentioned at the onset of this conversation, we have now 3 or 4 different areas of medical device cybersecurity as our focus points at MDIC.
That's great. It's great to hear. And you guys mentioned impact and the impact of cybersecurity. And that was one of the things that was on display at the recent MDIC MedTech Cybersecurity Summit, where there was a number of sessions that highlighted how cybersecurity kind of serves as this interconnection across multiple areas of healthcare. Could you guys give us an overview of the meeting itself and outline some of the key themes that came out of these sessions?
Sure. The Cybersecurity Summit that occurred on September 12th was a huge success. It was the first in-person event for MDIC after COVID lockdown. So there was a lot of reconnecting among coworkers and colleagues, and it was just a very nice environment to be in. But also, it did pave the way for lots of discussions about medtech cybersecurity. We had lots of very engaging conversations with senior level members of the FDA and industry experts within the summit. As we all know, COVID helped drive many industries to increase their online presence and their just presence within the the technology field. And particularly, the medical industry did shift dramatically into the technological space. So, protecting patients and healthcare entities through cybersecurity requires a lot of work. And this is why we are here, so that we can ensure that the future and the current, we are all protecting the future and the current workspace. And we are showing that patients can rely on us and rely on the medical field to enhance their well-being.
Cool. Jitesh, do you want to highlight some more themes that came out of these sessions?
Yeah, so of course I didn't personally attend the event. I was traveling, but I was so fortunate to be involved in the planning of the summit. I think the session was grouped into 3 different themes. The first one was on benchmarking, which we can have additional discussion during the session, and then another one was on penetration testing. And then one of the most important session was about a global regulatory landscape led by expert from FDA. As probably the audience can imagine, MDIC is a collaborative, is a very collaborative public-private partnership with the FDA as one of the stakeholder. And we were fortunate to have a lot of FDA subject matter expertise to discuss the global regulatory landscape, and again to reinstate the need for the lot of collaborative activities to ensure the cybersecurity controls and or accelerating the cyber security controls for medtech sectors. And again, I'm assuming we'll be able to have the recordings of these summit sessions made available in the coming weeks, so that those who had missed that opportunity to join will be able to watch the sessions, and most importantly, learn more about opportunities to interact with the folks through MDIC platform or other experts which we have convened during the meeting. So I think the meetings are not the dead end, it is the starting point of more and more activities and conversation. So looking forward to that.
Great. And for anyone that didn't have the chance to be there, you mentioned those three themes: benchmarking, penetration testing, threat modeling. Starting with cybersecurity benchmarking, can you talk to us about why that's important, and why is that an important tool to assessing threats and opportunities within cybersecurity?
Okay, I can give some brief overview. Um, as we are all been discussing, the amount of connected devices in the healthcare spectrum is increasing exponentially. Uh, that means companies, hospital systems, and device manufacturers, they all need to take care of or think about, additional security controls. Now, as I mentioned at the onset, there is no perfect 100% secure device. So this is a progress. That these are all progresses that we make in terms of how well we design these devices. So, as an industry, as a sector, are we making good enough progress in terms of cybersecurity controls? So there is not enough qualitative or quantitative information available, and I think every manufacturer for every specific product, they are including, or they are figuring out their own cybersecurity controls and improving upon it. Now, there are a lot of, open space or public discussion about the progresses that we make. Our effort, MDIC's effort, in collaboration with other like-minded organizations from public sector and private sector, what we are trying to do is we are trying to come up with some qualitative and quantitative analysis of, as time progresses, how well we are doing in terms of cybersecurity controls. That's the essence of benchmarking effort. Now, the key theme here is, of course, we cannot do any quantitative assessment unless and until we gather information from the manufacturers, device manufacturers, what are their current posture, and systematically analyze it. So MDIC worked with the Health Sector Coordinating Council, which is another public-private partnership recently, who last year proposed a framework for maturity for cybersecurity. And many manufacturers are utilizing that particular framework for their own internal benchmarking or some deviation of that framework. So what the MDIC did in collaboration with support from Boozer and Hamilton to come up with an online survey, and requested manufacturers to provide their cybersecurity posture through this survey. And we are in the process of coming up with our very first benchmarking report. Maybe Noor is the project manager leading the effort, and she might be able to give some milestones and progress that we are making on that front.
Sure. We are in the final stages of releasing the initial benchmarking report. Just like Jitesh said, we are anticipating for it to be released next month in October, which is also Cybersecurity Awareness Month. So it is a fantastic opportunity to learn more about the benchmarking initiative. And if you are interested in taking the survey, please go to the MDIC website. The survey will be there. You can go ahead and take it. And we do anticipate to create an annual MedTech cybersecurity benchmarking report that will allow companies to continue to strengthen their cybersecurity departments and to ensure the medtech industry continues to grow at the rate that we would like it to.
That's great. That's great to hear. So it sounds like you guys have a lot coming up for this project. You did mention at the MedTech Cybersecurity Summit that the cybersecurity benchmarking report would be groundbreaking. Tell us about why that is, what makes it groundbreaking, and kind of walk us through the process of creating this type of report.
Yeah, I mean, I don't know whether it is groundbreaking. Benchmarking is commonly done across for different aspects across the sectors. But as I was highlighting in my previous remarks, that for medtech sector, cybersecurity historically was not at front and center. We used to say historically cybersecurity for medical devices was an afterthought. Now that has been changing, evolving, right? Because as I mentioned, or as we were discussing, the amount of connected devices and the ransomware attacks and other hacking incidents. So it's been changing. So industries independently, industries in collaboration with the trade associations and other public-private partnerships like MDIC or Health Sector Coordinating Council, we have been all coming up with good ideas and good frameworks. And I think in terms of cybersecurity benchmarking or maturity benchmarking for medtech sector, we haven't had anything solid and concrete like what we have been, what MDIC is now undertaking. So in that, from that point of view, this is truly important. I'm also hoping, as Noor mentioned, manufacturers, small, medium, or large size, can come back to MDIC website at any point of time, utilize this survey and assess the posture of their cybersecurity, and then compare it with the industry. And I think this is a two-way of communication, because the more information more companies able to join our survey, our ability to assess the sector and the information is going to be more valuable as we produce these annual benchmarking reports.
Thank you for that answer. And so for the folks at home, definitely be on the lookout for what this team has coming up for cybersecurity. It sounds like there's a lot of deliverables and new information on the way. But to go to another thing that you guys mentioned from the Cybersecurity Summit, you guys talked about penetration testing. And within this field, there's a lot of talk across the industry about penetration testing as a whole, even though it's something that its usage in the medical device industry hasn't exactly been clearly defined. Tell us more about this opportunity and what that impact on the medical device or healthcare community could be.
Yeah, I can start off and then pass it to Noor. As we have been discussing, there are all these hackers or other attackers on our system, whatsoever their intention. Sometimes it can be just to gather the identifiable patient information, or sometimes it can be with other malicious intent. So the cybersecurity controls that we have to incorporate before marketing a device, we need to think like a hacker, or we have to think one step further or beyond the hacker. So the concept of penetration testing, which is not new in this for the software or cybersecurity field, but for the medtech sector, how the penetration testing has been employed as a verification and validation V&V tool, that's still in evolving. That discussion is still evolving. So there are uncertainties, and from a regulatory standpoint, from the implementation point of view, from the what are the best practices to do the penetration testing. So I think there is no doubt about the penetration testing is a very important step in development of medical device. But there are elements of its execution and its regulatory process. Those things need some clarification. So MDIC is contributing to that conversation. We have very active working groups at MDIC focusing on these aspects. These experts are from industry, other non-profit organizations, and of course from FDA and other regulatory agencies. Noor can probably highlight some of the upcoming deliverables from this working group, exclusively focusing on penetration testing.
Sure. So we are currently working on two white papers within the penetration testing working group. The first one will be penetration testing as a medical device process, and the second one will be the penetration testing best practices for the medical device sector. Both are anticipated to be released by the end of the year, and they are being worked together on by both the FDA and the private sector. So it's a very big initiative, and we are very proud to be part of this initiative.
So another initiative where you guys have a lot going on, a lot of new things for the folks at home to expect. And one more initiative where you guys, I think, have a lot of things where you've developed recently has been threat modeling. Um, can you tell us what is threat modeling for those that don't know, and what are some of the implications of threat modeling on the medical device industry as a whole?
Yeah. This, in the same way I explained penetration testing, when we design a medical device, we can actually, systematically analyze the potential threats, and then that systematic approach. There are different commercial approaches to do this threat modeling for while developing the medical device. So maybe if I say penetration testing is something which you do, after you have the device, and then you try to hack it, or stimulate or simulate the behavior of a hacker. That's the penetration testing. But threat modeling is, you systematically analyze the potential threats and then address it. Now, again, this is also an important, becoming more important piece in the development of connected devices. MDIC started working on threat modeling for medical device for past 3 years, actually, and our initial entry was in collaboration with FDA. Actually, FDA, MDIC received funding from FDA to do a lot of threat modeling awareness. We had coordinated 3 threat modeling boot camps, one exclusively for the experts, and then 2 to build up on more skilled workforce in this area. They were all, of course, the first one was an in-person event, and then 2 were virtual boot camps. And then, based on these learnings, MDIC, in collaboration with MITRE, which is another non-profit organization, developed a threat modeling playbook, which is available now for the public as a free downloadable resources. What we have done during the threat modeling boot camps and in the playbook is to have a lot of interaction with experts from industry and regulatory agencies, and come up with good educational informative examples on threat modeling and some systems, not which are agnostic to any specific vendor or any specific method, but a more systematic approaches and the thought process. So we have started, or we have been really fortunate to contribute this conversation, amplify this message about threat modeling, around threat modeling for medtech sector. And we are with the FDA funded project, we were able to start this effort as boot camps, but there is a huge a demand, and a lot of folks are looking for more information. And Noor has been working with some of our stakeholders and create additional boot camps and opportunities. Maybe Noor can highlight what we are going to do on threat modeling side next.
Sure. So, in collaboration with Shostak and Associates, we are hosting a 5-day intensive virtual threat modeling boot camp. Our first one will be on October 24th, lasting throughout that week, and the second will begin on December 12th, lasting throughout that week as well. Devin, if you don't mind pasting the link into the chat so that people can join us whenever they are for either date that they are available for. It is an incredible initiative, and more information can be found on the MDIC website. So please feel free to click and join us on either the week of the 24th or the week of the 12th.
Thank you, guys. So, as you mentioned, there's a lot of opportunities to get involved, and yet again, there's a lot of opportunities to get involved in this initiative. Um, Before we open it up to Q&A, for anyone who hasn't had a chance to add their questions in the comments for Jithesh and Noor, please feel free to do so. We'd love to hear your thoughts on anything we've talked about here today. But last question for you both while we're here. Talk to us a little bit about the future. I want to hear from you both. What does the future of cybersecurity look like? What could it look like as it pertains to the medical device industry? And how do you think that your perspective kind of shifts the way that MDIC's work continues moving forward?
Yeah, I think as I mentioned my initial remarks, we used to say that it takes a village for protecting the cyber safety of the medical device, because there is not a single stop or a single solution for this effort. For this activity, because uh, considering a medical device which is connected, you have end user, which might be a hospital, then you have a service technician who might be coming in, you have wireless or connected elements which might be accessible by patient or somebody else. So the potential vulnerability can happen from anywhere, so there is no single source, right? So it cannot be just the manufacturer's responsibility. It cannot be just the hospital's responsibility, and again, not patients, or not the healthcare hospitals or patients' responsibility. So it has to be a very concerted, connected event. And as I mentioned, there is not going to be 100% secure device. So it's going to be, we do the best, and then we share our best practices and learn from our experiences. That's why MDIC and the other similar-minded organizations coming up with all these case studies, examples, white papers, all these different ideas. And again, regulatory bodies are also doing their best part. So it's going to be a collective effort. And then I'm hoping there will be more discussion, more interaction, and more activities. So that's what my prediction. And right now, MDIC is focusing on these three areas. That itself is huge. And we are very fortunate, at MDIC level, we are very fortunate to have some of the very leading manufacturers and their cybersecurity experts to be associated with us and to inform us the latest issues. And we will be assessing the sector on a regular basis through our steering committee input, as well as our MDIC board of directors input, and then making calls on what new areas MDIC will be venturing into in cybersecurity as we move forward. But as again, I just want to highlight, in the ongoing projects, whether it is threat modeling or penetration testing and so on, or benchmarking, we do have opportunities for folks who are not MDIC members to interact and collaborate. So consider visiting our website and the links posted here, and improve and contribute to this conversation on a long-term basis.
Yeah, for sure. There's no shortage of things to get involved in within the digital health and technology team. So for the folks at home, take their advice. Feel free to visit mdic.org, or for specific cybersecurity questions, feel free to email the cybersecurity team at cybersecurity@mdic.org. Now, we're out of time for today, but I want to thank you both for spending a little bit of your morning with me, answering these questions, and for sharing this wealth of information with the folks at home.
Thank you.
Thank you for having us, Stefan.